All right, well, let's get it rolling. Thanks everybody for joining us this afternoon. Again, I think some people maybe are playing hooky and skipping early and enjoying this beautiful day, which is fine. We need more vitamin D in our lives. Welcome everybody to the Economic Recovery Briefing Call brought to you by PCERT, as we're commonly known, the Portage County Economic Recovery Team. Make sure you check out our website at portageeconrecovery.org. We're trying to update information as we get that. If you're on the call, you can see the slide with the website up above. You can also see the schedule. Gary Garsky, excuse me, I'm having a hard time talking today. Gary Garsky, our county health officer, is going to be speaking, and then Ray Ackerlin from Skyward is going to talk about their conservative and responsible return of employees plan. I'm sure Rebecca, who's on the call, is interested to hear how that's going to work. But couple little notes. First of all, this Friday is kind of like high school graduation day in Portage County. So we pushed out a message to our membership. Hopefully others will push that message out to post some things on social media. If you have a marquee, put something on your marquee congratulating all the high school graduates in Portage County. Obviously they were gypped of their ceremony this coming weekend, although many are trying to reschedule or do some things virtually. So make sure you do that. Also, the census is still going on. The census committee has been meeting. Make sure you get your census complete and encourage your employees. Maybe as you bring them back, you won't give them their keys until they fill out their census form or something like that. But that census is obviously important to our community. This will be recorded, so if you know of others who weren't able to be on, usually in 24 hours or so, Ryan gets it out there and posted to folks as best he can with the myriad of things that he is working on. So with that, I think we'll turn it over to Gary Garsky. Gary's been exceptionally busy the last 2 months, and particularly busy the last week since the Supreme Court ruling came out. Gary is the Portage County Health Officer, part of the PIO team, and always has a lot of great information to share. So Gary, go ahead and take it away.
Good afternoon, everyone. I hope everyone's staying well. And like Todd said, if you get a chance, go outside, enjoy the sunshine. It's great outside. Well, unfortunately, yesterday, Portage County experienced its 8th positive case. So again, our total stands as 8 confirmed. We have 5 recovered cases, and as of yesterday, we have 1,168 negative cases. To date, we investigated over 136 individuals since the start of COVID-19 in Portage County, and our counts continue to rise, except for yesterday, which is good. So again, we are now working towards supporting the pieces that are left of after the Wisconsin Supreme Court throughout the Safer at Home Emergency Order number 28, and putting into place, effective as last Friday, our first order providing guidance and recommendations for people to kind of move forward as we're now prematurely moving into what would have been phase 1 of the Badger Bounce Back Plan. We were actually set on target. I did a count yesterday. So prior to yesterday, our last positive case was May 3rd. And so actually we had 16 days expire since May 3rd before our positive case yesterday. So we would have entered phase 1 like 3 days ago. So we all entered phase 1 as of last week, Wednesday, throughout the state of Wisconsin. With that said, we understand that people are anxious to get reopened. People are very willing to reopen in a safe manner to conduct business in a COVID-19 environment. That's my first point in this, that even though the Safer at Home order went away, unfortunately, the COVID-19 virus did not. It is still with us, as we saw evidence of that yesterday here in Portage County. And so again, it's really all of us, all our responsibility to provide the due diligence to maintain the flattening of the curve that we were doing. And even though now we're in the harm reduction phase of pandemic response, to put forth efforts of social distancing practice in our community to maintain low numbers of occurrence of positive cases of COVID-19. I'm going to stop there to see if there's any questions about our numbers. Okay. So moving forward, we are planning to release a second order, hopefully by this Friday. I will tell you, I've been working on this since last week, Friday, when we got a new opinion from the Attorney General as a template of guidance. it's now the local responsibility to enforce and control movement forward related to how we as a community operate and interact with one another under the auspice of communicable disease control, which is has granted authorities to me as the health officer under 25203 subparts 1, 3, and 4. And so we are doing our due diligence and using that as our enforcement tool to try to maintain our case count as far as positive cases that occur moving forward. The most recent order, which was last Friday, again, really just kind of outlined basic premise and giving all businesses guidance and referral to what was put out in place 2 weeks prior under WEDC, the Wisconsin Economic Development Corporation, at www.wedc.org. They have great resources, which is truly based on scientific principle, the best practices from around the country as supported by CDC and other health entities. And I really truly recommend that people go out and explore those as for guiding their next steps to reopening. And if you've already reopened, to maintain a safe environment for the customers that you serve and or your employees that you have on your work sites. Moving forward, the next order actually will provide, again, based on the opinion from the Attorney General, will provide more guidance, more specifics as far as occupancy. Again, it'll have it really focuses again about trying to maintain social distancing practice within our community. Trying to protect the vulnerable populations that are still existing in Portage County. And again, that is defined in that order, or will be defined in the order as well. And really moving forward, I know people are asking how is this enforced. So again, we'll be working with local law enforcement to help us curtail large gatherings. We're kind of giving some leniency in that the recommended group size right now is 10. But based upon the opinion of the Attorney General, when you look at occupancy rates of different organizations and businesses, they're allowing currently 25%, as long as you can maintain 6 feet of social distancing within either your place of work, your business, and or a facility open to the public. This would include faith-based organizations as well. And so again, I really have a hard time setting a limit when I look at something like St. Bronislava, for example, that can hold like 1,000 parishioners, and so 25% of that, let's say, is 250. So why is that allowed? And again, it would be allowed because the social distancing can be observed versus a group that's only 50. So there is some give and take to that. But again, we're really doing our best with the guidance that we have to protect the public's health. And that should be released shortly. Any questions on anything I said?
Gary, there's one that was posted. Whoops, let me slide back up to it a second here. So the person who was positive, is there anything you can share in terms of, was the contact, do we know it was from inside Portage County or from outside Portage County? Or I know there's a lot of legal
yeah, and I can backtrack a little bit. So again, I think the last time I talked to you, we might have been on the eve of doing what's called our wing testing, and that was our Wisconsin National Guard assisted testing here in Portage County. That did occur last week, Monday and Tuesday. During that event that was hosted here at our agency at Portage County Health and Human Services, we were able to collect 348 samples. We are anticipating 500 samples, so I was very happy with the results. But again, that testing site was not only open to residents of Portage County, but was open to anyone from Wisconsin. So of our 348 samples, we did have 2 positive cases. Both of those cases were outside the jurisdiction of Portage County, so they were not our residents. With our case yesterday, so keep in mind that one of the goals of having a safe reopening and being able to kind of keep our pulse on the spread of COVID-19 in our environment is to have more opportunity for testing. That has been occurring over the last 3 weeks throughout the state of Wisconsin, not only through the wing testing that's been available throughout the state, as was done here in Portage County, but we're having more and more of our providers providing not just simply COVID-19 testing for individuals who, because they have symptoms, think they need to be tested, which is great because they should be tested. but are also now requiring, as they're opening more of their medical centers and healthcare procedures, there's a requirement that anyone undergoing a medical procedure needs to have a COVID-19 swab as a screen prior to being admitted to a healthcare facility. So our person, that's how they were detected. They went through a pre-op screen for a medical procedure. They were not symptomatic. So in that regard, I'm very, very grateful for the fact that we have this in place, that in order to ensure the safety of our healthcare facilities, we are requiring pre-screening for any individuals who are admitted for medical procedures. Had that not been in place, we would have not caught this case. And so again, it does highlight the fact that there really are cases of individuals who are asymptomatic that may never develop a symptom, but who are positive for COVID-19.
Great, thanks. I know it's all complicated and detailed. Again, we thank all the work you do. Another a question that I kind of have, and there's some confusion, I think. We hear the term order and we hear the term guidelines used a lot. And I know that the Portage County put out an order last week, but essentially my understanding is they were primarily guidelines. So can you maybe help Gary clarify between those two terms and what we might expect in the one that's going to be coming out later this week?
So the order truly is the act of how we're looking to enforce the work around controlling the spread of a communicable disease like COVID-19. And again, that falls under 252.03 under state statute and our authority to do so. We rely on guidelines to have that work done. So again, the reason these are guidelines, and again, put out by WEDC, and they're not administrative code, is that they're guidelines because they were developed in response to how do you control the spread of COVID-19 in a work environment and in places that serve the public. They have not yet been adopted by administrative code. I don't know if we'll ever see a time, unless this really is super ongoing with the presence of COVID-19 in our communities. But because they weren't adopted into administrative code, they're simply just put out as guidelines or guidance. So again, the order is the act of how do we put into place a way to protect the public, but it truly is based on the guidance and guidelines that are available either through WEDC, DHS, or CDC.
Okay, thank you. We have a more specific question about some of the conversation out there. So is Gary saying that our bars and restaurants can only open at 25%? And that doesn't necessarily match with what the WEDC guidelines that have been put out. So can you give some for our bars and restaurants that are on the call?
I'm going to say and again, we had this conversation with the Portage County Tavern last week. So again, they want us to give a number. And again, that's really hard. I would say that the basic rule of thumb, and again, the new order isn't complete yet, but the basic rule of thumb is looking at your establishment and how do you provide the ability to have 6 feet of social distancing, which if you're looking at like occupancy and square footage, it's 36 cubic feet. And so, if you have a floor space that's X by X, you got to figure out, okay, if I divide this by 6 feet, what does that look like? And that then sets the occupancy that should be obtained. And keep in mind, currently that would be the maximum occupancy. So as a rule of thumb, I think that's good guidance, because again, if you have anything more than that, you obviously can't maintain 6 feet of social distancing. But there's matters that complicate that, and this is some of the things that complicate it. For example, if you have a household of individuals who all live together come into your establishment, they obviously don't need to maintain 6 feet of distance among themselves because they're from the same household. But individually, they need to maintain 6 feet of separation from others who are not part of their household who may be around them. So you can kind of see that there's some difficulty in trying to describe what's needed. And so the basic rule of thumb is to provide 6 feet of separation around everybody. And that would set your occupancy.
All right. Thanks, Gary. I get to hear you on a lot of different calls throughout the week, as do many of us. And this is, as you can tell, folks, just from the last few minutes, this is not an easy thing to deal with when we're trying to decipher these different guidelines and orders from the state level and trying to do what's best for our community. So appreciate all you're doing and your staff and how you're working well to make the best solution for Portage County.
Oh, and Todd, we truly appreciate the work of everyone in the community because it truly is a community effort. And thank you for the opportunity to speak today.
Absolutely, absolutely. So again, folks, if you do have questions, pop them into the chat box. That's where we got some of the questions we just talked to Gary about. And let's see, there's one other one just came up. It says it'll be very important to convey the local authority behind the order, and that how it can and may be enforced. There's just some general disconnect, some confusion out there. So again, as Gary puts those out, and as the municipalities communicate on that, business council and others, we'll do our best to make that as clear as we possibly can. So thanks again. So now let's turn it over to Ray Ackerland. Ray Ackerland is the president of Skyward here in town. And we thought it'd be great to have a business talk about how they're planning to reopen. And as I said before, they're doing I would say a responsible, conservative opening to their facility and for their staff. So with that, Ray, I'll turn it over to you.
All right, thanks, Todd. So a couple things I just want to say. One is thanks to everybody that is attending here, and certainly thanks to the entire group with the economic recovery team and what you all have been doing. I think this has been a great service for our community. I think one thing to kind of keep in mind, obviously, from our perspective in Skyward and in an office complex, the way that we approach it is going to be obviously very different than a lot of other businesses. And I tried to craft the presentation in a way that it hopefully gives some general guidance that will be beneficial for everyone, but certainly other organizations that are a similar office complex or office structure like us, hopefully they can gain a little more insight in kind of some of our ideas and recommendations. So Ryan, if you jump to the first slide. So, obviously from the beginning, one of the most important aspects of this is trying to understand and make sure you have a strong balance, obviously of the needs of your business operations, but as well with your employee health. And that was the two things that we continually look at from our perspective of how do we make sure to balance those as efficiently and effectively as possible. And, that's kind of been the overarching aspect, is to make sure that we're able to protect our employees, keep them safe and healthy, but as well be able to continue to operate from a business perspective. And throughout this, I will say our employees have been absolutely tremendous in what they've been able to accomplish and what they've done. And that's really been a testament to our success. And I really got to give all the credit to them of how things are progressing, and as we as an organization continue to move forward. So when we take a look at the next slide, this is kind of just some of the general overview aspects that we took into consideration as we really began to develop our process from a return perspective. And the first thing that we did is we established a return to work leadership team, and we took some folks that really kind of represented key areas within the organization, especially folks that were tied to our buildings and grounds and our facility management, things along those lines, to make sure we had a good understanding of, as we are starting to return employees, how we do make sure that the building has proper sanitization, what's the process to maintain social distancing, and so on. And that has been really, really helpful, because we've been able to have a smaller group so we can make a little bit faster decisions, a little bit more agile in our decision process. But at the same time, we're able to gather feedback from our entire our entire employee base, which in our building here in Stevens Point, we've got a little over 400 employees that we're taking into account throughout this process. One thing that we looked at too was to make sure that we're able to protect our vulnerable employees. And when we look at those employees, it's not just the employees that fall under the CDC classification of high risk, but are there additional employees that kind of fall into that category as well, that might be have certain situations. So we wanted to make sure to take those employees in consideration and give them a little added protection as well as we develop this process. And for us, what stood out to us is that we decided to move into and develop a phased approach that was going to obviously first and foremost minimize the risk, but allow that aspect to return employees to work. And one thing that we found is that even in talking with employees, there was a pretty broad perspective of employees that wanted to get back quickly for a number of different reasons, and we had other employees that had serious concerns. And this phased approach really allowed us to be able to understand that and take that into consideration, and and obviously be focused on making sure when employees do come back, they are comfortable. Part of that is just one, their safety and their protection, but at the same time from a productivity perspective. If employees are coming back and they have a huge amount of anxiety, or it's a difficult situation for them, their productivity is going to be impacted, which ultimately will then as well impact the organization. So taking those things into consideration. The next piece with that is we established multiple contingency plans based on how things occurred. Perfect example just here with the state of Wisconsin, when we first developed our initial phase, that was well before the Supreme Court made their decision. And we had, I think, a process based on how that was progressing in the Badger Bounce Back Plan. We took that, obviously, when the Supreme Court lifted the stay-at-home order, and we saw, an expansion of people out in the community. We looked at that and how that impact may be from a virus spread perspective. We also took a look at what other organizations are doing as well to understand their model and their approach, because we have a lot of employees that have spouses at those organizations as well. So we've got to take all those factors into consideration. So we actually have adjusted our plan multiple times since our initial announcement to our employees. So it is one of those things that you kind of continually be prepared and have different plans in place that, depending on what happens, you're able to respond to that as quickly as possible. So when you jump into the next slide, this really kind of gets into really what was the specific, our specific model from a phased return perspective. And the first thing we wanted to do was really kind of open up the doors purely from a voluntary perspective. These are employees that were absolutely the most comfortable coming back to the office. They had either a need or a desire to get back into the office. And along with that, it was going to allow us to be able to really verify the processes that we're putting in place, whether that includes employees self-monitor or self-checking before they arrive at the office. What is our process when they do arrive to sanitize any equipment that they may be bringing back? Really and instructing them on how to follow proper guidelines when it comes to breaks and lunches, and as well within the actual work environment to make sure they've got adequate spacing between them and other employees in the building. So those are all things that the guidelines that we've put in place and identified that they will be able to follow when they arrive at the building. But we want to make sure that, one, the process that we've developed covers all the different aspects that we need it to cover, and as well as that employees are able to easily understand it and follow that, and to really see what are those adjustments that we need to make. So as we would have additional employees returning over the coming months, that we've got a good plan in place with that. Right now, our anticipation is we do not have any volunteers in the office as of right now. That'll be something that'll likely occur in the next month. And then based on how this progresses, based on how other activity progresses as far as it relates to Memorial Day and what happens there, and evaluating kind of what happens with the virus as a whole, we'll be making additional decisions on those next phases, and as we roll those out to bring employees back in a way that's safe and protects those employees as much as possible. And with that, and that's where you really got to be prepared to adjust in both those directions, because that is a situation that we could see certainly this go in either way, and that's where you've got to be prepared to handle that. One thing that we are working very hard at is to constantly be communicating information that we're aware of to our employees, so they're understanding what we're doing as an organization, how that impacts them, collecting their feedback, and so on. So that's an area where, again, being prepared to address that, just kind of how things develop both locally and at a state level, is very critically important. And again, throughout the process, making sure to protect those employees that are considered high risk is really important. One factor to keep in mind with that is that based on guidelines that are put out, if an employee, even though they're in that high risk category, if they want to come back to the office, as I understand it, you cannot prevent them, even though they're in that high risk category. If they want to return, that is something that you have to support. So you need to keep that into perspective, as well as when you are developing your guidelines, is that you could possibly have employees that are high risk that will be returning because they would like to, or they want to be in those early return phases. The last piece that I just want to touch on is something that, from us in our perspective in an office environment, is that issue of once we get to that point where all of our employees will be returning to the office, you will find in scenarios where you're going to have employees that will be looking to make requests to work from home permanently. And again, these are decisions that you need to make, I think, from a perspective as a business, and each business is a little different on how they operate. From our perspective, what we look at is when we ultimately are able to get back to that stage, to whatever that new normal is now, whether that's 3 months, 6 months, or 8 months out. But having folks back into the facility for us is very important because there are inherent values when you are able to have a good, clean operational work environment. That's really important for those employees to be there. There's a certain level of collaboration and interaction that obviously helps promote and create better productivity when it is in a clean environment, a safe environment. But along with that, for us, there's a huge importance from a safety perspective and security perspective when we look at the data that we use and things along those lines. So those are all elements for us that are extremely important. So that's something that we are, making sure to communicate out, that people understand that ultimately that is our goal, to get employees to return. However, there certainly are going to be situations where we will see those requests come in. And there's a lot of factors that could impact that of why they're asking that request. The two things to really, I think, keep in mind for this in your situation, if you have an office environment, one is to ensure that you're establishing good consistency when you are approving any arrangements that you make for employees, because it is certainly a scenario of if you make an exception for an employee, you've got to make sure they have that consistency for other employees as well when additional requests come in. And then the last piece is to look at it from that special consideration for those high-risk employees. Again, I'm an optimist, as Rebecca probably starts laughing now. I do feel that once we come around to fall, once we hit those winter months, we will see some good developments that are going to make our ability to return better, and things will improve, both from a treatment perspective or vaccine or whatever it may be. But again, you're going to have those scenarios where you may find high-risk employees still need additional protection or additional considerations. And those are things I think to again, keep in mind and allow more flexibility for those employees and go forward from that perspective. So that's kind of the general idea that I wanted to cover, and certainly am happy to answer any questions that I can. So I don't know, Todd, if there was any questions.
Well, thanks, Ray, for sharing that. Appreciate it. This question is kind of coming from me, so I hope you don't hang up on me. But one of the huge issues, and you may have touched on it. If you did, I apologize. But one of the huge issues we'll be facing is childcare for a lot of employees as they start going back in the workplace with summer programs really cut back. The Boys and Girls Club, for example, right now can only take 50 people per facility. They're allowed 300, and there's many other examples like that. The schools will not be allowed to be open at least through June 30. So how have you been able to incorporate that, or how has that fit into any planning that you've done, in terms of your employees coming back and what you're looking to do?
Yeah, that certainly had an impact. When we talk about the aspect of the community impact in our decision to initially, our plan is that we were going to be having folks beginning to return at the end of May here, really kind of early June. One of the factors that we took into consideration when we decided to extend our stay-at-home or our work-from-home process for our employees was because of the daycare situation. It's not just the fact of the limitation of what's available for daycare, but also the concern that we saw from employees that really looked at it from the perspective of, are they comfortable actually having their kids in a daycare setting? So we have been able to, I think, look at it from that perspective and change our direction in our process because of those types of external factors, not just the factors of the building or the virus or things along those lines. One side note I will mention with this, so again, an area that we're, I think, rather fortunate of is that we as an organization are very focused on analytics. So we are able to really analyze our employee production and our overall production as an organization. So we're able to see exactly how we are meeting our objectives and meeting the goals that we need to in comparison to, say, for instance, when we were in the office in Q1. So that allows us to make sure that we're still being productive, and that adds a lot of confidence to us from a leadership perspective to know that we as an organization can continue to operate effectively in this environment for as long as we need to.
Well, Ray, my daughter works for you, and I've been trying to keep her working hard. It's kind of a challenge, but I'm doing my best to keep her under my thumb with that. So there is one.
It's funny.
Here.
I think she told me the same thing about you. So.
Oh, no. She must have me confused with somebody. There is not a question, but one comment, and it's from Ben at Midstate. He said, "Thank you, Ray, for all the efforts to protect your employees and our community members. Your flexibility is changing conditions is commendable." There is one question here. Person said, I may have missed it. Do you have any guidelines around employee personal and or business travel guidelines, especially around areas where there's a community spread or areas considered as hotspots? So I'm guessing, business travel, personal travel, people coming back from other communities. Do you have any particular guidelines regarding that?
Yeah, we've established a number of different guidelines internally as far as how we're going to handle the travel situation. And we've looked at it both from a business perspective and from a personal perspective. On the business perspective side, the interesting aspect that we're running into is that traditionally in, say, for instance, June and July and into August, we would have a lot of our employees traveling out because this is a key time for us to implement new customers. However, what we found is our customers are telling us that they are not allowed to even have people come into their school districts to do the implementation. So we have transitioned all of those from, instead of having our staff travel to their location, we have been doing all the training via a web training tool. And we actually are having really great success with that. And it actually is a little bit cheaper for our customers. So from their perspective, they're appreciating it because if folks are not familiar with Skyward in depth, we work with K-12 public schools and they're all are going to be facing budget shortages here probably for the next 18 months. So from a business perspective, travel-wise, we've been able to limit that travel and not had a situation where we've had folks coming in. From a personal travel perspective, we have put in guidelines that in the scenario when we have situations for employees that would travel, especially if they travel to a hot spot, whether it's out of the country or in the country, we have steps in place as far as what our expectations are with them. Obviously right now, because we are having all of our employees work from home, we are recommending that they quarantine. But it is we are allowing that flexibility really based on CDC guidelines. Once we have employees return to the office, we anticipate we'll probably have a little bit more stringent expectation on that. But again, that'll probably be dictated a little bit based on what the guidelines are from the CDC and from the state when we get closer to that time frame.
Great, thanks, Ray. And just a couple things. The business council, we have 5 full-time and 2 part-time. We're opening up on Tuesday. We've done a lot of the deep cleaning. We've changed filters, those sorts of things. We've got some plexiglass shields we're going to have in our reception area because we do have customers coming in. Disposable mask, hand sanitizer, safe distancing, all those same sorts of things too. So it's obviously not as complicated for an organization our size, and each person has their own office. So the one thing we are doing that people may not have thought of, and I heard this on a chamber call, we're going to be recording visitors in the rare event that any tracing may need to be done if somebody comes down with the virus. So that might be something that folks consider. Now, if you have a restaurant and people charge, you have their charge card information where you can trace from that, but we might not have that. So that's something to think about too as well. I don't see any more questions. Any other comments or thoughts, Ray?
Not that I can think of. I think that's it.
All right, great. Well, thank you very much. Appreciate you taking time. Just like Gary, you're busy in your own way, getting your business keeping moving and up and running again as you move forward. So thanks very much for that. Ryan, any questions come in through the email? Nothing through the email. Any other follow-up you'd like to share?
No, I think just in general, the economic recovery team is going to wind down a little bit here as the safer home order has been lifted. There have been some great, I think, regional discussions on economic development and urban economic policy that are going to come out of this organization. And so I'm kind of looking forward to being part of that. But I believe next week is likely going to be one of our last briefings as we go forward. But we're still going to stay in close contact in the event that COVID does start to flare up again, if you will, that we can come back and be active as quickly as possible to help our local businesses through these tough times. So that's all I have from my end.
Great, thanks a lot. Let's all take Gary's advice and play hooky the rest of the day. He gave us a permission slip. It's recorded here, so if you get in trouble with your boss, just give him this recording, because Gary Garski said we can take the rest of the day off and enjoy the sun. Take care, everybody. Be smart, be safe, and stay healthy. Thanks a lot.